Hello, fellow nursing educators. Today I'm going to tackle the standard error of measurement, or SEM. Now, I know this might sound like one of those intimidating statistical terms, but I promise it's actually a helpful concept that can boost your confidence when you're interpreting exam scores. Let's break it down together in everyday language. So, think of the SEM, or the standard error of measurement, as your margin of error for test scores. We all know that any measurement contains some error. It's just reality. But SEM helps us understand how much wiggle room to expect in our students' scores. Here's a simple way to think about it. When a student takes a test, their score is our best estimate of their true knowledge. But factors like test anxiety, question wording, or even just having a bad day can affect their performance. SEM tells us how much these factors might influence their scores. Just like a weather forecast, it gives us a range. Like if we said today's high will be 75 to 78 degrees. SEM helps us see student scores as a range rather than an exact point. So let's make these numbers meaningful with an example. Say your exam has an SEM of 1.71. That's like the total SEM. This means that if a student scores 85 on the exam, their true score likely falls somewhere between 83.29 and 86.71. I'm going to show you how you can use these statistics in your personal professional practice. Now, you might notice that individual subcategories have higher SEMs than the total test. This is completely normal. It happens, and it's because these two reasons. Subcategories contain fewer questions, which typically increases measurement of error. Also, the total score combines all these pieces. That tends to balance out individual errors. Now, if you have a lower SEM, like 1.71, this indicates greater precision. You can be more confident about where a student's true knowledge falls. Higher SEMs in subcategories suggest we might be a bit more cautious when making decisions based solely on those section scores. Now, how you practically apply this? How do you use SEM in your teaching? Well, when you're making important decisions about student performance or even passing, keep these things in mind. Because when you're making important decisions about student performance, consider the SEM when a student scores near a passing threshold. Remember that subcategory scores have wider confidence bands than total scores, and use total scores for high-stakes decisions when it's ever possible. Now, when you're communicating with students, help them understand that test scores are estimates, not exact measurements. Encourage that they focus on patterns across multiple assessments rather than the small differences. And consider sharing both scores and their confidence intervals for important exams. Remember, SEM isn't about questioning your exam quality. It's all about being realistic about what any single measurement can tell us. It actually demonstrates your commitment to fair and thoughtful assessment. You're doing important work, and understanding these concepts helps ensure your assessments are as meaningful and fair as possible.